Hakuna Mkenya tena akiwa na ugonjwa wa saratani ama kansa ama diabetes ambaye atauza mali yake ili aweze kulipia gharama ya hospitali.
President William Ruto's promise to Kenyans lies on the future plans his government has for the sector. In 60 years, one of the major transformations in healthcare is the devolution of services to counties.
We now have a neonatal ICU at Mbagathi thanks to devolution. We now have our first ICU at Mamalusi thanks to devolution.
Among the major moves by the government to universal health coverage is remodeling the National Health Insurer to accommodate all Kenyans and serve them optimally. The National Health Insurance Fund was formed in 1966, tasked with financing healthcare provision for Kenyans.
It was primarily formed to take care of those in formal employment. And it was mandatory, I think at the time, anybody who was earning more than 1,000 shillings was supposed to contribute to the fund.
In 57 years, however, NHIF has enrolled only 16 million Kenyans, saying that it means mandatory for those in formal employment and voluntary for those in informal unemployment and unemployed Kenyans.
We've only been able to cover 27% of the population. Something is not right.
That has to increase because the ideal is to be able to have people pre-finance healthcare so that you're not paying for it at the point of receiving the service. You're paying for it in advance, and at the point of receiving the service, there should be minimal out-of-pocket expense.
The NHIF is currently undergoing a one-year transformation and transition in Social Health Authority following culmination of concerns noted by the NHIF.
Catastrophic health expenditure is one of the concerns that there was. We also have a very inequitable contribution system. So how do you make sure everybody contributes to that scheme? Because that is the principle of social health insurance.
With all Kenyans on board, the National Health Insurer, coupled with support from the government, the Social Health Authority projects more funds being remitted to a tune of 275 billion shillings, each Kenyan paying 2.75% of the earnings.
Those who are in non-salaried employment or informal employment, again using the means testing instrument, that household income will be calculated and you pay 2.75%, but theirs is an annual contribution. And this is the way that has been devised to go around the aspect of erratic contributions. For example, you've got somebody who is diagnosed with an illness today in anticipation of need of care. That's when they're going to contribute.
This notwithstanding, Kenya's health sector funding still falls short of 2001 Abuja Declaration that requires African nations to finance healthcare at a rate of 50% of national budget.
Funding of healthcare has been 8% from the 80s until now. We cannot fund healthcare at 8% and think that we're going to have magic. It will never work.
The government recently launched 100,000 community health promoters tasked with bringing health services closer to the people, especially those in rural and underserved areas. This move continues to attract mixed reactions.
Do we really need 100,000 community health workers? How will you know that this person needs zinc supplement or needs calcium or whatever it is? How will you know? You have so many trained nurses and trained clinical officers who are unemployed. Why don't you cut it down to 10,000 and then give somebody a decent salary as opposed to 5,000 shillings, give them 50,000. These clinical officers and the nurses can be able to do that.
As President William Ruto gears to roll out universal health coverage in January 2024, Kenyans look forward to accessible, affordable and quality health services across all health centers. Reporting for HLC TV, I am Michael Sifuna Kongowea.